Hi, welcome back to my YouTube channel. So for today we're going to learn about the chemical in medicine and healthy. This chapter is from chapter 10 from 4 KSSM. I am Puan Rosmawati. Please click like button and subscribe. Okay, our medicine is we can say it in 3 types. One is traditional medicine, modern medicine, and complementary medicine. So first of all, we're going to learn about the traditional medicine. So this traditional medicine refer to the knowledge, skill, and practices based on the theories, belief, and experience indigenous to different culture, used to maintain the health and in the prevention, diagnosis, improvement or treatment of physical and mental illness. Method based on the traditional medicine knowledge. Okay, so meaning in this traditional medicine is based on the certain culture of that race. Okay, so it's based on the belief and theory and experience. The second type of medicine is modern medicine. This modern medicine is conventional modern medicine, is sometimes called allopathic medicine. Is involved the use of drug and surgery, often supported by the counseling and lifestyle measure. Medical techniques they are used to treat and diagnose disease based on the science and scientific research. Okay, we can conclude that modern medicine is used drug and surgery based on the scientific research. So the third type of medicine is called complementary medicine. Complementary medicine, also known as the traditional or alternative medicine, include vitamin, mineral, herbs, aromatherapy, and homeopathic products. So complementary medicine may be either licensed or registered, depend on their ingredient in the claim made. So this complementary medicine they have to register. Method that combine traditional medicine and modern medicine. We can say that the complementary medicine is a combination between the traditional medicine and the modern medicine. So again, traditional medicine is traditional medicine are derived from a plant or animal. Traditional medicine are usually not processed. Okay, any medicine plant contain alkaloids. It's potentially toxic to the liver. So traditional medicine can cause serious side effects. So more research on the toxic and adverse effect of traditional medicine should be carried out in order to ensure the safety of this medicine to the public. So this traditional medicine normally they did not process. So it's come from the plant and animal. So normally they are boil the plant. So in the plant there is the toxic accumulate in the plant itself. So when it not processes, so they have a lot of the serious side effect. Okay, so the source, the type of the thing that used in the traditional medicine is the garlic. So we believe that garlic to treat cold and asthma, lower the blood pressure, or also act as the antibiotic. So how to use in traditional medicine? We just eat raw or cook it. Okay, so cocaine, this one is anesthetic. So this drug is produced from the leaf. So actually this is a type of drug. Ginseng, for the Chinese person, they are believed that ginseng can strengthen the body, strengthen the body. And how to use it? Boil with the water or to produce juice. Quinine, it treat malaria. produced in the bark of the tree. Ginger, so this one also we believe that ginger treat the stomach ache, treat the diarrhea and prevent flu. So how to use it? We boil with water and produce juice. Peppermint, to increase the body metabolism, treat nausea, indigestion and flu, to treat headache, muscle and nerve pain. So how to use it? Boil with the water to produce juice or taken in capsule. And the other one is tongkat ali. The scientific name is Eurycoma longifolia. So they are believed that in Malay peoples, they are believed that they can treat wound, relieve headache, to lower the body temperature and increases male virility. So how to do it? Dry it and boil with the water to produce juice. Serve as a hot drink, beverage, or made into tablet or capsule. So this is an example of the substance that used in the traditional medicine. The other one is tamarind, is asam jawa. We know that they can reduce malaria fever, reduce cough, medicine or for gastric problem. So how to use it? Dry and serve as a cool drink. So Malay believe that if you had a hot body, when your temperature rise, you drink the asam jawa as a cold drink, it will drop your body temperature. So lemongrass or serai, so this one we can use to mosquito repellents, treat cough, headache and stomach ache. So how to use it? Made into juice. The other one is a daun pegaga, or in scientific name is Centellia asiatica. So this one we believe that can help maintain youngfulness or awet muda, relieve hypertension, aid womb and healings. So how to use it? Eaten raw or made into juice. The other one is green tea. So Malaysian people believe in the green tea. So we believe that can prevent breast, stomach and skin cancer, improve mental alertness, lower the cholesterol level. So we can drink as a beverage. Okay. So people who going to want to slim also, they eat the green tea because it's able to we believe that it's able to increase our metabolism. The other one is aloe vera, or in bahasa Melayu we call it as a lidah buaya. So we believe that they can heal womb and skin disease, laxative, treat diabetes, osteoarthritis and sunburn. So how to use it? Eaten, cook or leaf produce juice and rub on the body. So we know that a lot of cosmetic product they are using aloe vera because they believe that is can reduce the skin disease. So this is the photo of the herbs or the thing that you use in the medical traditional medicine. Herbs normally believe in Indian people, Chinese. Okay, ginseng is very popular in Chinese people. Melasma, which I believe can do the awet muda. So tongkat ali, okay, and this pegaga. Okay, now we're going to the modern medicine. So modern medicine are the medicine that are manufactured on the large scale for consumer. So modern medicine are chemical that are extracted from plant or animal. So we can say that the medicine that we use in modern medicine, so we are extracted from the plant and animal. They also could also be synthetic chemical, but some they are produce the medicine by using synthetic chemical. So this medicine include, so we have three type of medicine. So it's include analgesics, antibiotic, and psychotherapeutic medicine. So we have three type: analgesic, antibiotic, and psychotherapeutic medicine. So we go one by one of these three type of medicine. So analgesics is a modern medicine to relieve pain, commonly known as a painkiller. So analgesics does not treat that causes of pain, but just to relieve pain without causing numbness or affecting the consciousness. So this one we known as a painkiller. The popular one is a Panadol that we taken, right? But this medicine is not cure the disease, but only want to release the pain. This example is paracetamol that Panadol we use, and the aspirin. Okay, so we use this one to relieve our pain. Okay, now the second type of modern medicine is antibiotic. So people, girls, I'm sure you are used with the antibiotic. So antibiotic are modern medicine that kill bacteria, used to treat infection caused by bacteria, but not to cure infection caused by viruses such as flu and cold. So this not to kill virus, but it's only to kill to cure the disease that causes by bacteria, obtained from the bacteria and fungi. So this antibiotic we are produced by using bacteria or maybe fungi. Should be finished to make sure that all the bacteria are killed, or one can become ill against, and bacteria may become more resistant to the antibiotic. That's why doctor will always remind you to finish your antibiotic, because if you need not finish it, so the bacteria become stronger and it's become resistant to the antibiotic. Example of antibiotic, penicillin. Okay, so it's give you it's come from the bacteria, and the streptocidin is come from the fungi, if I'm not mistaken. Okay, so this is a two example of the antibiotic that we use. Okay, last one, last type of the modern medicine is a psychotherapeutic medicine. Psychotherapeutic medicine. So our modern medicine used to treat mental illnesses. So it's especially for the mental illnesses, used to alter abnormal thinking, feeling, or behavior. Okay, this medicine did not cure mental illnesses, but just reduce the symptom of mental illnesses. So meaning the people who get problem with the mental, they only to reduce the symptom, but not to cure them. Okay, so this is example of the psychotherapeutic medicine is stimulant. Actually they got three. Stimulant is an antidepressant. Okay, now we go for the complementary medicine. You can see the photo. We have massage, cupping, or in bahasa Melayu we call it what you call it, cupping in bahasa Melayu, or bekam. Okay, the other one is acupuncture. It's used in very popular in Chinese and heat. Okay, so these four type of the complementary medicine. So massage has a long been practiced for the postpartum care, passment, body age, and dislocated bone. So we always use massage. Cupping use gentle pressure through the heat or inhalation by vacuum in a cup. So in bahasa Melayu we call it as a bekam. Okay. So acupuncture is a medicine practiced in China to cure disease by pushing certain area of the skin with the tip of a needle. They are using needle and just put on the skin, not penetrate into the muscle. Okay, so the purpose of acupuncture is to stabilize blood flow and improve health. Okay, now we are going to give the comparison between medicine from natural and man-made sources. So, okay, for the green color, garlic. So this one is a side effect, digestive tract problem, but man-made is antibiotics. So the side effect is rash, nausea, and vomiting. Sometimes we are not tolerate with the antibiotic, we get vomiting. Okay, ginkgo biloba. The side effect is nausea, dizziness, and vomiting. Whereas aspirin, sometimes people cannot tolerate, they get a stomach ache. Tongkat ali also will give the dizziness. For man-made is painkiller. For example, the Panadol, they will get the inflammation of the stomach and intestine. Aloe vera. So some people they cannot tolerate to the aloe vera, will cause the muscle swelling or diarrhea. Whereas the man-made medicine, antihistamines, so the side effect is you will get sleepy. Okay, for the natural, so this is another comparison between medicine of natural and man-made source. For example, the vitamin C available from the natural resources. So vitamin C in supplement is obtained from the chemical reactions such as ascorbic acid. Okay, for vitamin C, lower risk in side effect, so has more side effect from the chemical and easy to absorb by the body. For vitamin C in the supplement, take long time for the body to absorb. So we can conclude that it's better for us to take a natural vitamin C because it's low side effect and easy for the body to absorb. Okay, now we go learn about the misuse of the medicine. Abuse of medicine is then when a person consumes medicine without the need and without consulting the healthy professional. So some people they abuse the medicine by taking the medicine without consulting the doctor. Okay, medicine abuse can lead to the medicine addiction. For example, the painkiller, sleeping pill, and stimulant. So when we did not follow the schedule that give by the doctor, this medicine will become addicted, right? Okay, excessive consumption of the antibiotic can deteriorate by the body immune system against the bacteria. So if you take a lot of antibiotic, so it will be the bacteria in our body can tolerate with this antibiotic, so it will against our immune system in our body. Okay, so excessive cough medicine weaken the scent and causes addiction. So this one also, some people will purposely take the cough medicine to get addicted. Okay, that's why cough medicine is under control. And also the excessive consumption of the paracetamol, Panadol, can cause liver damage. So this painkiller also will cause liver damage. Okay, now we're going to learn about the free radical. So what is the meaning of free radical? Our body are made up of million or molecular that coexist during chemical bonding. So our molecule in our body is made of molecule, right? So this molecule, they have bonding between the molecule. Okay, now look at the figure 10.4. So oxygen molecule is broken down and produce an unstable atom. Okay, look at the first diagram. So there is the chemical bond between these two atom of hydrogen. So when the hydrogen, or when the atom is sharing the electron, you look at the photo, right? It is sharing the electron. Why? Because the electron actually is supposed to be pairing, right? So this chemical is very weak, so it's able to break down. So now it's become the atom of hydrogen, which are unpaired electron. So look at the last orbit or last shell. You can see, suppose at last shell you have 8 electron, but this one only 2, 4, 6 and 7. So the one is unpaired electron. So this one will become the free radical, which are unstable and always attack another atom to get stable. Okay, so back to the note just now. The chemical bond of some molecules are weak, and this allow them to be break down. So this situation result unstable atom with unpaired electron. Okay, so you can see the electron supposed to be pairing, right? But this one is a unpaired electron. So it's become free radical. Atom are with one or more unpaired electron in their orbit or shell. Okay, unpaired electron causes radical to become very reactive. So this free radical attack nearby cell to replace the electron and achieve a stable electron arrangement. So when this unstable electron try to attack nearby cell, it's become the chain of the unstable atom. So when it attack another atom, so this another atom will be break down. So it will, another atom also will be go to another atom to break down. So you can see the long chains of the unstable atom. So the action of free radical is continuous, and this cause millions of nearby cells to become free radical. So that's why I said just now, it keep on disturb other molecule, and it will cause a long chain of the unstable molecule. So when prolonged, this condition will cause a chain reaction. Free radical can be formed by natural metabolism or pollution, radiation, cigarette smoke, toxin, stress, lack of exercise and lack of sleep. Okay, look at the diagram. So you can see the arrow, you can see the orange arrow and the green arrow. So the orange arrow is the factor that cause the free radical, whereas the green arrow is a consequence of free radical. So we go for the factor first. So the factor that can cause the free radical is pollution, alcohol, drinking alcohol, cigarette smoke, stress. So when you stress also will release the free radical, or when you eat fried food, so the fried food also able to produce more free radical, or maybe radiation from the radioactive, or maybe radiation from your phone, computer, and also the pesticide. Okay, pesticide is a racun serangga. So this is a 1, 2, 3, 4, 5, 6, 7 factor that can cause the free radical. Okay, now we look at the sequence or the effect of the free radical. So this free radical can cause cancer, can cause damage of skin and diabetes and cardiovascular disease, and also can cause cataract. Okay, so this free radical is very danger. Okay, so now we're going to learn what is the antioxidant substance. Okay, so antioxidant substance can happen to our body if we do not take action against damage of free radical. So just now we learn about the free radical. So this free radical were able to damage our body. So in photo 10.7 you can see the oxidation of the apple when it is cut and exposed to the air. So this is the example of the reaction of free radical. So when you cut the apple, is very nice, it look juicy and mouth watering, but in a few seconds or a few minutes, so the reaction of the oxygen will damage the apple. So this one is the reaction of the free radical. Okay, you just imagine if our cell is like this. Okay, so antioxidants are substances that prevent oxidation. So antioxidant is a substance to prevent the oxidation, to prevent or to overtake or to overcome the free radical. So antioxidant protect the cell from the damage by free radical action. So antioxidant can be described as an electron donor to free radical. Okay, so now you look at the process how this antioxidant able to recover the free radical. Okay, look at the first antioxidant. They have 1 to 3 electron. Okay, so normally we need only a pair of the electron. So this electron will be donated into the free radical which are having only 1 electron. So now the free radical will get 2 electron, and the antioxidant also get 2 electrons. So that's how the antioxidant is neutralizing the free radical. So girls, the example of food, there are a lot of antioxidant is kiwi, fruits, kiwi, carrot, okay. The other example is green leaf. I mean the orange, tomato, strawberry, citrus. So all these food or vegetable or fruits is containing a lot of the antioxidant. So you have to eat more vegetable, eat more fruit to get a lot of antioxidant to make sure you become look younger and healthy. Okay, so now we go to the next subtopic is a health product. So nowadays we come across a lot of health product that produced by the factory, right? So an active ingredient, it is compound that produce chemical or biological effect in a substances. So some ingredient is added in the health product. For example, of ingredient is active ingredient is diphenhydramine, okay, and ibuprofen. So most of these ingredient are entered or are added into your health product. So usage for this one is to the sleep medicine for the insomnia patient. Ibuprofen is active ingredient in painkiller. Okay, consumer are encouraged to identify the ingredient and the proper way to use a product to avoid undesirable side effects. So we as a consumer has to know what we should take and what we do not. Okay, so girl, we are finished this chapter. Hope you try to answer the question in your textbook. Thank you for watching. I'm Porasmawati, and don't forget to click the subscribe and like button. Bye until next session.